Good day, class. For today's topic, we will be talking about another COVID 19 series, but this time we'll be focusing more on the COVID 19 antigen testing. For the overview of what antigen tests are, these are commonly used in the diagnosis of not just COVID 19 class, but also other respiratory pathogens. That includes influenza viruses and even respiratory syncytial virus. Antigen tests are immunoassays that detect the presence of a specific viral antigen, which indicates current viral infection. So, in using antigen tests, we are currently authorized to perform it on samples that are nasopharyngeal, nasal swab, or saliva specimens placed directly into the assay's extraction buffer or reagent. The currently authorized antigen tests include point of care, laboratory based, and even self tests. But we don't usually honor results that are from self testing class, so we focus more on the point of care and laboratory based testing. Antigen tests produce results quickly, so that's around within approximately 15 to 30 minutes, and most can be used at the point of care. Antigen tests, however, for SARS-CoV-2 are generally less sensitive than real-time reverse transcription polymerase chain reaction, or otherwise known as the RT-PCR, and other nucleic acid amplification tests. Because both of this class, RT-PCR and NAATS, or the NATs, they detect and amplify the presence of the viral nucleic acid. Also, for your information class, the gold standard for clinical diagnostic detection of SARS-CoV-2 remains laboratory-based, either moderate and high complexity testing. So, the gold standard, once again, for COVID is the nucleic acid amplification tests. Okay? Is that clear? All right, so let's go back to the main principle of the 2019 nCoV antigen testing. It follows a lateral flow method, and it is based on the principle of immunochromatography sandwich for the determination of 2019 nCoV antigen, which is extracted from what? The nasopharyngeal swab or oropharyngeal swab specimens. When the extracted specimen is added into our test device, the specimen will then be absorbed into the device through capillary action, and it mixes with the 2019 nCoV antibody dye conjugate and flows across the pre-coated membrane. When the 2019 nCoV antigen level in the specimen is at or above the target cutoff, so that means that's the detection limit of the test, right? So, the antigen bound to the antibody dye conjugate are combined by 2019 nCoV antibody immobilized in the test region of the device. So, it produces a what? A colored test band that indicates a positive result. But if the 2019 nCoV antigen level in the specimen is 0 or below the target cutoff of the test, there is not a visible color in the test region of the device. This means, class, that if there is no colored band in the test region, then it indicates that that is a negative result. To serve as a procedural control, there should always be a colored line that will appear at the control region if the test has been performed properly. So see here in this diagram, class, that this is the proper way of interpreting the results using the 2019 nCoV antigen test using the lateral flow method that is based on the principle of immunochromatography. Please take note also of the different precautions that we must put into our minds in using the antigen test kits for COVID-19. Number one, this kit is for in vitro diagnostic use only. Number two, all specimens should be treated as capable of transmitting diseases. So you must always use the appropriate precautions in the collection, handling, storage, and even disposal of patient samples and the use kit contents. Number three, wearing appropriate personal protective equipment like your protective gloves, medical mask, goggles, and laboratory coats when handling the contents of this kit. Next, if the virus sampling solution is used for specimen processing, it can be directly detected without using extraction buffer. Number five, proper specimen collection, storage, and transport are critical to the performance of the test. Sixth precaution, discard everything after first use. The sample extraction tube, the dropper, and the desk device cannot be used more than once. Number seven, avoid excessively high temperature in the experiment environment. Test cards and detection buffers stored at low temperature need to be returned to room temperature before opening to avoid moisture absorption. Number eight, do not touch the reaction area of the test strip. Ninth, do not use test kit beyond its expiration date. So what's the use, no? And number 10, do not use the kit if the pouch is punctured or not well sealed. Number 11, testing should be applied by professionally trained staff working in certified laboratories or clinics at which the samples are taken by qualified medical personnel. Number 12, the test result should be interpreted by the physician, that is along with clinical findings and also other laboratory test results. And lastly, write this down, the disposal of the diagnostic. All specimens class and the used kit are already infectious risk. So make sure that you dispose all of it and follow the correct process of disposing the diagnostic, and you will also follow the local infectious disposal law or the laboratory regulation regarding this. For the specimen collection and preparation class, we actually can use two specimens, that's nasopharyngeal or oropharyngeal swab specimens. For nasopharyngeal swab specimen collection, you tilt the patient's head back around 70 degrees. Then insert the swab into the nostril and make sure that the swab should reach a depth equal to distance from nostrils to outer opening of the ear. You leave the swab in place for several seconds to absorb the secretions, and then slowly remove swab while rotating it. You have to collect on both nostrils. For oropharyngeal swab specimen collection, you do the same thing. You insert the swab into the posterior pharynx and the tonsillar areas, and then rub the swab over both tonsillar pillars and the posterior oropharynx. When you try to remove already the swab glass, you make sure to avoid touching the tongue, the teeth, and the gums. It is recommended that the specimen is tested at the time of specimen collection. If the specimens are not tested immediately, they should be stored in a dry, disinfected tube and tightly sealed. So you place the tip of swab into a tube and snap or cut off the applicator stick. They may be stored at 2 to 8 degrees Celsius for up to 8 hours, or they may be stored at negative 70 degrees Celsius for a long time. In doing the test procedure proper, you make sure that you read the instructions for use carefully before performing the test. For every newly opened box glass, the manufacturers always provide the procedure manual. So don't worry because it is duly provided. The COVID-19 antigen test kits that we will be using in your activity class has already a pre-installed extraction buffer. So after specimen collection, you unscrew the lid of the extraction tube and then insert the swab which has collected secretions into the pre-installed extraction buffer. Rotate the swab tip 5 to 10 or more times against the bottom and sides of the extraction tube to release the specimen from the swab tip. Take out the swab while squeezing the middle of the extraction tube to release the liquid from the swab. By the way, make sure to leave the swab in the extraction buffer for at least 1 minute. After that, you may discard the used swab and then cover the lid. Next is you remove a test cassette from the sealed pouch by tearing at the notch and place it on a level surface. Unscrew the small cap at the top of the extraction tube and add 80 microliter or about 3 to 4 drops processed specimen to the sample well, and you may start the timer. Wait for 15 to 20 minutes and read the results. Please do not read results after 30 minutes. That is to avoid false positives. This picture here is a simplified procedure on how to process the COVID-19 antigen test kits. For the interpretation of results, when the test is positive, it shows colored bands that appear at both the test line and the control line. So class, this indicates a positive result for the 2019 nCoV antigen in the specimen. If the test is a negative result, it shows a colored band only at the control line. This indicates that the concentration of the 2019 nCoV antigen is at 0 or below the detection limit of the test. If there is still a concern that a person has COVID 19 after a negative antigen test, then that person should be tested again with an RT PCR test. The test is considered an invalid result if there is no visible colored band that appears at the control line after performing the test. The directions may have not been followed correctly or the test may have deteriorated. It is recommended to resample and test. In the quality control of antigen test kits, there is always a procedural control that is included in each test. A colored line appearing in the control region is considered an internal procedural control. It confirms sufficient liquid volume, adequate membrane wicking, and correct procedural technique. Good laboratory practice recommends the use of the control materials. Users should follow the appropriate federal, state, and local guidelines concerning the frequency of assaying external quality control materials. For the limitations of the procedure, number one, this reagent is designed to detect 2019 nCoV antigen in human nasopharyngeal or oropharyngeal swab specimen. The accuracy of the test depends on the sample collection process. If there is improper sample collection, improper sample storage, or repeated freezing and thawing of the sample will affect the test result. The reagent of this test is a qualitative assay. It is not designed to determine the quantitative concentration of 2019 nCoV antigen. So if you need to test the quantitative concentration, please use the relevant professional instruments such as RT-PCR and nucleic acid amplification tests. The test results of this reagent are for clinical reference only and should not be used as the sole basis for clinical diagnosis and treatment. The clinical management of patients should be comprehensively considered based on their symptoms or signs, medical history, and other laboratory examinations and treatment response. Also, limited by the method of antigen test reagents, especially for negative test results. It is recommended to use nucleic acid detection or virus culture identification methods for review and confirmation. And lastly, positive test results do not rule out co-infections with other pathogens. A negative result of this reagent can be caused by number one, you write this down, improper sample collection, improper sample transfer or handling, or the virus titer in the sample may be too low. Another cause of a negative result will also be the level of 2019 nCoV antigen is below the detection limit of the test. And lastly, variations in viral genes may cause changes in antigens determinants. For the cross-reactivity of the test kit that we will be using in our activity, the 2019 nCoV antigen test using the lateral flow method was evaluated using specimens containing the antigens listed or the one that is found on the screen. The results class showed no cross-reactivity with the following: the common coronaviruses NL63229E and OC43 antigen, the MERS-CoV antigen, influenza A H1N1 antigen, influenza A H3N2 antigen, influenza B Yamagata antigen, influenza B Victoria antigen, respiratory syncytial virus A or B antigen, the rhinoviruses A and or B antigen, adenovirus 1, 2, 3, 4, 5, 7, and 55 antigens, the enteroviruses A, B, C, D antigen, the Epstein-Barr virus antigen, measles virus antigen, human cytomegalovirus antigen, rotavirus, norovirus antigens, mumps virus antigen, the varicella zoster virus positive samples, and Mycoplasma pneumoniae antigen. The test result also of 2019 nCoV antigen tests using lateral flow method do not interfere with the following substances. You can also see from here, class, the different medications that are under allergic symptoms, antiviral drugs, antibiotics, and systemic antibacterial drugs. Please also take note of this flow chart wherein we can see the different tests that we should be doing on three different types of patients that we encounter in the laboratory. One is, of course, the symptomatic patient. One is an asymptomatic but with close contact with a known COVID-19 patient. And the last type of patient is the asymptomatic and does not have a known exposure to any COVID-19 positive patients. So that is it for our lecture regarding the COVID-19 antigen testing. I hope you've learned something new from me today. Please continue to keep safe, wear your mask, disinfect your hands, and make good choices. Thank you so much again for listening and have a great day.